What is something I recently changed? You're going to love this, Dr. Palmer. I want to say it's tough, and it's not going to fit everyone, but you're asking me personally, so I'm going to share my experience. It's not all about the money.
Hello, everyone, and welcome back to the podcast for doctors by doctors. My name is Dr. Ned Palmer. I'll be recording solo today. Unfortunately, Dr. Jerkins cannot be with us. However, I have brought an excellent physician replacement in the form of Dr. Gerald Cox, who is an entrepreneur, a lifestyle medicine doctor, and overall just a good hang. I'm really excited to have this conversation with him. I hope you all get a chance to learn something about these opportunities that we have as physicians to support people through their entire life, not just in the hospital, not just in the clinic, just trying to make them healthier, better, and more functional individuals. It's a fascinating conversation with a quadruple board individual. He may have the most boards per doctor that we've interviewed yet. And so I'd like you to join me in welcoming Dr. Gerald Cox. We have the one and only Dr. Gerald Cox. He's a unique leader in modern precision medicine. Dr. Cox is a quadruple board certified physician whose work sits at the crossroads of internal medicine, obesity medicine, preventative medicine, lifestyle medicine, and digital health innovation. He's the founder and medical director of Mirror Health Specialists and CEO of Mirror Health and Wellness, where he integrates precision medicine, metabolic health, and patient-centered technology to achieve sustainable real-world wellness. Dr. Cox also serves as an associate professor at Loma Linda University, one of the blue zones, which we're going to talk about, with the most centenarians in the world, where he has trained and mentored the next generation of physicians. Prior to launching his own organization, he served as a clinical site director at Kaiser Permanente, where he expanded clinical training programs and helped integrate AI-enhanced documentation tools to improve workflows and the provider experience. His research and publications span these fields, and his work consistently focuses on improving patient outcomes, sustaining longevity, and building scalable, community-centered models of care. What truly stands out about Dr. Cox is his ability to blend scientific evidence with behavioral insights and compassionate care, empowering both patients and clinicians with practical strategies to tackle chronic disease and elevate metabolic health. Dr. Gerald A. Cox, welcome to the podcast for Doctors by Doctors. I'm really thrilled to have you here.
Dr. Palmer, I really appreciate you. Thank you for having me on. Honestly, I think it's just wild how it was a Medscape post of yours that really just kind of led to I was like, man, whoever wrote this was really good. Let me send an email to this person real quick. And then 3 years later, here we are.
I appreciate that. You're too kind. I had a lot of help writing those Medscape posts, up to including one of our other podcast producers. So, it's this same team, and I'm glad that we came together through this kind of serendipitous medicine being a very small world channel. I love it.
That's how it should be.
I want to dive right in. You are the most board certified doctor we've ever had on this podcast. I think boards per doctor, you stand apart. I thought Dr. Jerkins and I at two were kind of on the nerdy end of the spectrum, but you jumped over us super quickly by getting four board certifications. You're now running Mirror Health and Wellness. But let's talk about you a little bit. I want to learn from you. What early habits or mindset helped you thrive across this diverse clinical practice, AI, and digital health innovation sphere that you operate in?
Oof, you want to go way back, huh, Dr. Palmer? All right. If we're going to do that, I would probably say it started with childhood obesity, honestly. I was an overweight child growing up. That was junior high was really a challenging experience. Your body's changing, your mind is changing, your mindset around everything that you really understand around the world and how you're taking that in changes. And then at the end of the day, then there's also this personal aspect of, wow, am I happy with myself? I really wasn't. I had, I was 132 pounds and I think, was probably around 7th grade, and then I was really struggling with that growing up, and my mom recognized it, and she recognized it early in me, and she was really a motivating force to try to change things and help me kind of see things from a different lens. We actually did a weight loss program together, and when we went through that together, I lost a lot of weight. I came to recognize that I actually can make some different choices in my life that would lead to certain results. And I was trying to actually, and from that moment onwards, it was really just a reflection point for me. Going, fast forwarding a few years later, I actually started getting into personal training. I was a personal trainer at LA Fitness, and I just loved that. I just loved that, man. I wanted to be able to bring that into medicine, and so that's what kind of led to this journey. But it doesn't answer the digital health innovation part, and that was actually in high school when I was doing a tech program. And while I was in the tech program, I was kind of picking up on some of these different computer aspects, programming, and a little bit of some electrical engineering. And then that kind of just slowly just became like, okay, yeah, I might dabble with some computers here and there. And then once AI came around, I was like, oh no, this is now we're more than dabbling. Now we're getting in.
Absolutely. So, I mean, let's talk about that just very quickly, because we're gonna really dive into what AI has done to medicine and what you've seen it do in your life and things like that.
For sure.
You mentioned that right at the end. Like, what has AI done? What's the quickest way to explain what AI is doing to digital health innovation right now? And what's your feeling on it?
We always talk about these different segments in history, right? Where there's this exponential period, right? There's these four different periods of the Industrial Revolution, and artificial intelligence, without a question, is one. When we first, when you and I were probably, in kids, and we recognized when that iPod came out, or, when we recognized, right? You remember that first iPod, that brick that you had to carry around, but it was different than your Walkman. I feel like this is exactly what we're experiencing in medicine today. We've been blessed with the opportunity to learn from our forefathers, right, in medicine, who, before they had up to date, they had to go to a medical library, take out that textbook, and sit down with that diagnosis,
Galen's anatomy textbook from the 1500s is still there. Like, it's
pulling out that Netter's, like, wow, is that what that nerve looks like? Okay.
Yeah. Oh, bright yellow. That'll make it easy for me as a med student.
100%. You get into lab and you're like, wait, I thought it was yellow. What is this white string here?
Everything's tan colored and smells like formaldehyde. It's terrible.
And the environmental exposure of that is another story. But but I think that's what we're experiencing, man. We're experiencing a complete shift. Like once we started getting into the large language models of artificial intelligence and that ability to be able to read physician notes, and especially breakdowns of radiology or any real medical specialty, honestly, the computers can actually digest that information, and now we're having an advancement where we can kind of use and leverage some of this technology for some of those mundane, some administrative tasks that was really kind of taking away the opportunity to really connect with our patients.
I love that, because I think that's a thing that we've experienced. I'm sure, again, we're of the same generation going through healthcare. We've seen both sides. We probably may have had some training experiences in paper charts and what it was to actually document on paper, the rise of computer-generated note-taking, how horrible that was for a long time, and frankly still is. And now this kind of like, as the pendulum swings back and forth, this idea of like, use AI to make the administrative side of things better, so I can like redouble down and focus on the care.
Exactly.
I love that, and I'm excited too. And I'm excited. We're really going to dive into that a little bit later, but I'm very excited. But again, you've had such a broad and diverse set of experiences. I kind of want to open up with a couple more questions just to give our audience a sense of like what you've been through in medicine. I think it's always helpful for, our younger listeners or trainees to know how variable your career can be in healthcare, because it often just looks like one path from down there. But so you have transitioned from supporting congressional health initiatives to running a concierge medicine practice. What was the most surprising lesson in that transition?
My concept of time, I would say, was probably the biggest shock to me. I feel like time management as a physician, you kind of pick it up, right? Because you're seeing a patient, whether it's in the hospital or in the clinic, and then you're taking that. You have that kind of mental time in the back of your head that kind of goes off. That timer goes off. It's like, oh, okay, I really need to move on to the next patient, right? And unfortunately, those are the kind of constraints that we work within, right? But I would say that once I made that transition to entrepreneurship, I thought that I had this kind of perception of time. I had this like, okay, I can send out all these emails. I can see these patients. I can, build the clinic, contract with insurance. I could do all of that this week. right? I mean,
Mhm.
but right?
Sure.
Yeah, let's do that this
Sure.
week. But then what I came to realize was like, oh man, no, this one aspect is an arduous process that might actually take several months. This other aspect is something that's going to take another several months. Getting to the business plan, like, wowee, that's going to take me like 5 months, right? Put together a P&L statement. That's like, oh, wow, I don't have a finance degree. Let me try to figure this out. So my concept of time totally changed. It's like, okay, I think I need to be more realistic with myself and what these goals are, and maybe come up with a 6 month plan, a 12-month plan, a year and a half, 2 year plan, because doing that is just going to be allowing me to be more kind to myself as I make the leaps and strides to getting those tasks done.
When I hear you describe its perception of time, I think it's also, there's an element of locus of control in there, right? I think when there's certain areas where it's just you and you're grinding away, like, I can't do this all in a week, but you don't control payer credentialing. You don't control opening an bank account integration into your accounting system. You don't control your EHR being up or frankly
Right.
down. Like all of these other things that play into it. That as I'm sure you got into as an entrepreneur, you realize you're almost like there's dependencies that you're not used to.
100%.
Right? As just like a clinician
Yep.
blasting through. You know what a
Right.
20-minute visit is, right? And you can do
Right.
that every single time. But to build all the systems and wrap around, like all the interdependencies, I guess, that you have to build on are huge, right?
I love the way you put that. You're basically saying like, oh, you mean there's more variables in the equation, right?
Yeah.
We're doctors. We don't we like to minimize variability, right? We want to put that.
We're risk box people. We don't like late stage new variables coming in. That's risk. That's horrible. Oh, we can't control for that.
Exactly.
Yeah.
We can't control for that. That locus of control is gone, and that's hard for a lot of people to deal with. I'm sure building the Panacea was probably a similar experience for you as well.
I think, as it never goes away. Once you're in, you're like, okay, there's just constantly new bits coming around, and you create a different heuristic, basically, of how to manage and mitigate risk, which again, which we'll talk about in the entrepreneurship moment. So, I do want to ask one question, going back to kind of your comments about AI and this new industrial revolution, or fourth generation of the industrial revolution. I'm not even sure what we're calling it from an era standpoint here. But if you could spend a day shadowing any physician or innovator in AI-enabled medicine, who would it be? And then you got to tell me why too. A name's not good enough.
I probably have to say Dr. Anthony Chang. I think that he's one of the leaders. He actually was the one who created the American Board of Artificial Intelligence in Medicine. He's a doctor who actually decided to go and do a master's in data science, and he's over at Chalk in Orange. But he's one of the leaders of artificial intelligence in medicine, and he has a lot of insight. He was talking about the convoluted neural networks, or the CNNs, in which computers would be able to digest radiology imaging, and then next thing you know, we're able to determine race based off of a chest X-ray. Like, what kind of vision is that? Like with 90% accuracy. That's pretty wild. Like, what are we missing, right?
Have we had the ethics conversation about that yet?
Is that another conversation down the road? Because we're going to have to.
It feels like there's got to be an ethics conversation right behind that. I mean, that's wild, right? Like, what the capability set of what AI can do now, right, is just leveled up so far. I'd love to hear more. So that's who you'd spend. That's who you'd spend the day with. Have you had a chance to meet him before and work with him before? Or just a fan from afar?
What? I'll probably say I'm a fan from afar. I was in a couple of his lectures when I was taking that board exam, but I never really got a chance to meet him and actually pick his brain. That would, or shadow him, to answer your question.
Yeah. I mean, if that's where his work has been over the last several years, I imagine he's incredibly busy and a tough person to get to give up an entire day for. So that makes a certain amount of sense.
But God willing, throw me in there, coach.
Yeah. Someday, hey, maybe he's a listener, and if that's the case, we'll connect you guys.
I mean, you're gonna have to connect me with Mark Cuban, since he was on the show too. I mean, that's pretty wild.
Okay, all right, yeah, we'll work on that too. I know Dr. Jerkins, and he's staying in touch, so we'll make sure to make this connection. So look, as somebody who, again, I really have enjoyed that, like, we've kind of come up through the same era, like, of this very traditionalized and traditional health system. I imagine both of us had some of those shared experiences of, like, the system is not meeting the needs of the patient. And at the end of the day, it is hammered into us for a decade or decade and a half, depending, of training of, like, the patient, the patient, the patient. And then you see what the system does to patients. So what was it, or when did you realize the traditional healthcare system was not doing what your patients needed, and that, like, your transition to concierge care was the fallback, was the solution here?
I'm so glad you asked that question. Honestly, it was when I was working at one of the largest managed care systems in the United States. I think managed care does a great job of doing what it intended to do, which is mitigate cost. And what I found was that cost mitigation was not the type of care that a lot of patients were asking for. And it honestly put doctors into a very difficult situation where we know what's best for the patient, right? Speaking of ethics, we know what's best for the patient. You want to get what's right to the patient. The patient wants what's right, but now you're hitting so many bureaucratic roadblocks to be able to provide that level of treatment, that level of care. I think the best example, Dr. Palmer, would actually be, those commercials that you watch and they say, ask your doctor about ... right? I get so frustrated when I watch those commercials because I'm like, no, don't ask me. Ask your insurance. Like, call them and ask them about coverage for this medication, because going through that prior authorization and these barriers of entry is just is an arduous task. So that's what led me to switching over.
It's horrible. And it leads to, first of all, it's this lack of autonomy, right? I don't mean to keep harping on locus of control, but we hear about this from physicians in the burnout sphere all the time. It's that at the end of the day, you're not able to make the decisions that you have spent a lifetime training towards. And you are forced to do things within a box defined by, frankly, not physicians. And you're not even making the decisions, based off what's in the best interest of the patient. It's what's in the best interest of the patient, asterisk, that I'm willing to pay for today.
Our forefathers in medicine had a term that I actually just recently came across in the last year or two. It was a doc in the box. I never heard of a doc in the box. I was like, but it kind of makes sense. Like I got this wall here, and now I'm just, Dr. Palmer, I'm a mime. I'm just like,
yeah, you're feeling around for the boundaries, and yeah, over here is United Healthcare, and over here is Aetna, yeah.
Yeah. Oh, prior authorization. Don't touch that.
No, that's hot. Oh, that one hurts. Yeah. So, I want to hear more about the transition to concierge. I don't do outpatient. I do exclusively inpatient. I'm a hospitalist. So this is a whole world that I don't know even a little bit. But I'd love to hear more about your concierge practice, like how you've managed to, frankly, make that transition to focus on patients, like get some of the, garbage out of the way so you can really drill down.
Going through that system, I came to recognize that, my patients are asking for one thing. I'm providing them another. My hands are tied behind my back. But what if I were to consider a different option, right? What if I were to take that leap, right? That leap that I feel like every entrepreneur kind of fit, just happens. Just like, gosh, you're so riled up. You know that you could do better, and you could do better for the people that you serve, that you went through, 10 years of schooling, if not, a little bit more or less, to provide these patients with. And so for me, it just got to a point where I was just in this internal infliction where I was just like, my patients deserve better. I know they deserve more than what I'm providing right now. And I know I'm capable of providing that for them. So with that, with that internal conflict, it's like I was faced with two decisions: continue in the system that I was practicing in, which was just complete internal moral abuse, right? That a lot of doctors bring up today, right? That leads to burnout. Or, take a risk, right? Do I take this chance? Do I go out on my own? Do I haven't credentialed with insurances, the hospital owns my MPI. Like, I'm trying to figure out how do I go about this process down this railroad tracks and be able to deliver this level of care. So at the end of the day, just, I looked at my wife, we looked at each other, we had a good discussion about it. And it's like, you know what? All right. I think now is the time to just make that leap. And I'm glad I did. It really, once I opened my doors, patients are like, this is the type of care that I've been looking for. This is, you're the, they tell me you're the future, or your clinic is the future of medicine. And I feel like people want personalized care. They don't want check the boxes level of treatment. And I think that there's a lot of local news that have happened as of lately that people are kind of waking up to that new influx. Like, no, see me for who I am. See me for the childhood that I had, the adolescence that I went through, the environment that I live in. Don't try to say one size fits all.
Totally agreed. I mean, I love, your approach to personalization and individualization. It's so much of medicine, and look, like both of us have a public health background as well, where public health is all about drawing lines around groups of people so that we can study them better. It's about depersonalization. It's about de-individualization to like try to understand things better. But then you have to flip it, right? And at the end of the day, you have one person sitting on the bed in front of you, or on the examination table, or something else. You don't have, between 19 and 24-year-old, this race, this ethnic group, this geographic distribution, so how do you integrate that clinical care, labs, lifestyle interventions? Like, again, help me understand how to create an individualized health plan. Like, just what's your mental model as you go through this?
I think that mental model really got shaped while I was in that blue zone and training in Loma Linda. When I got that lifestyle medicine board certification, that's what I really kind of realized, and having that background of that childhood, adolescence, and working as a personal trainer and trying to develop myself in that way, I kind of realized that, there are these little micro aspects to that kind of all add up. And the summary is really that patient on the examination table, like you described. So my thought process really is to get to those different points. When I was, I actually ended up doing a psychology degree for my bachelor's, and I knew it was going to help me, but I didn't know in what regard. So when I talk to my patients, I really try to understand what is contributing possibly to their symptoms or the diagnosis. Tell me a little bit about, I always start with like, how can I help you today? Or, tell me a little bit, those open-ended questions. Tell me a little bit more about what you're experiencing. Okay. And then I try to follow those breadcrumbs, because ultimately the patient wants the help. Now, there are some patients that, come in with positive everything. And that's just basically going through the weeds. But I really try to understand the patient as to, where they're at, where they're coming from, what is their experience, what are they doing on a daily basis. And I really try to put all of that together to say, or to see, what's leading to this presentation. And I think that with those open-ended questions, with that open mindset, trying to eliminate bias, which is, was a very hot topic of education that has lately changed. But I think that trying to eliminate biases and work through those biases and try to really see that patient who's in front of you, that's really where my mindset is from the very beginning of the encounter.
I love that. So before we go deeper into that, I do want to talk for a minute, a little bit about the blue zones, because I think this is research that was, to me, it was super popular. I want to say like 15 years ago, maybe 20 years ago. And so to me, it's a term, I think we're both public health nerds and trained in public health. So can you explain blue zones to people who may not have come across them before, or just like missed that when it was the most popular thing in the world in health for at least a couple of years?
Absolutely. I mean, there's this innate aspect of being human that is like, I want to preserve my life and I want to live to the, an old age, but I don't want to be a decrepit old age. I want to be very active and, very enjoying my life still. And what we found was that in these different areas of the world, there were these people that were what we call centenarians, or the average of living beyond 100 years old. And these people are really living their lives. I mean, they are the poster child of over 100, mowing their lawns, hanging out with family and friends, gardening, and that's what these little pockets around the world have. And those pockets ended up developing the term blue zones. I think it was a National Geographic publication that led to that. And these blue zones became such a hot topic during that time that, investigators and scientists were like, yeah, that's really cool, but why? Right? but why? What's leading up? How? Why and how are they having these lifestyles that are leading to beyond 100 years old, while we're seeing other pockets of the United States or around the world in which people are living to 60, 70, 80 years old? So how do you expand life by an extra 30, 40 years? And that's what that led to the popularity of blue zones in these locations where these centurions are living their best lives.
I love it. I mean, I think there were, I want to say 5 original blue zones, and Loma Linda was one of the ones. It was the only one identified in the U.S. was Loma Linda, California. And I think there was Japan, Okinawa, Japan, and then there was Greece had one, I want to say, and then there were like maybe 2 more in the Caribbean, but Dominica was one. So I'm a Caribbean graduate. I went to Ross in the Caribbean. And Dominica was, I think that after they found the initial 5, they then found a bunch more of these. Dominica as an island nation is the only, I think, island, like small island nation in the Caribbean that counts as one of the like second level blue zones. So, so they're close.
I knew there was a reason I liked you, because I went to the Caribbean too. I was actually at St. George's, a hot skip and a jump away from you.
Hot skip, yeah.
Yeah, but I think there's one in South America too. I think in Costa Rica.
Yes, Nicoya. I've been there. I'm sure I'm saying it wrong, but I've been to that community.
You know it though.
But no, it's fascinating research. If anybody, again, just blue zones were so popular 15, 20 years ago. They were all the talk of longevity medicine and how are we going to learn from these people so we can all be. And I love how you described it, not just 100 years old, but 100 years old and living your life. And so like you have that quality that goes along with longevity. So if anybody hasn't, if any of our listeners haven't, please take a look. There's some fascinating stuff out there. There's a lot more research now and what it's spun out. So thank you for talking that with me.
Oh yeah, come on, I'll nerd out of this all day.
Yeah, I thought you might. So going back to individualized health plans, a huge part of what I suspect you're tackling are chronic diseases. Or NCDs, non-communicable diseases, however, whichever classification you use, wherever part of the world you're trying to, yeah. Such an important part of NCD treatment and management is motivation, it's coaching, it's understanding what that person needs to keep moving forward beyond just the drugs, right? And I think that's a big part of your individualization, if I'm hearing it. So like, how do you keep patients motivated while tackling things that are hard and unpleasant, like obesity and type 2 diabetes? Like these diseases rob you of joy, and treating them doesn't make you feel more joy. You need to get to the other side before you start getting that. So how do you keep the motivation going?
There's some very good educational principles around motivational interviewing and motivational interviewing techniques. The American College of Physicians, or the ACP, has when it comes to obesity, and you can, if there are any doctors listening, you can look it up. It's an obesity medicine hub on the American College of Physicians website. Just Google search it, and they talk about these motivational interviewing techniques. So there's really trying to listening to the patient with these open-ended questions, and then trying to get down to what is encouraging this patient. Sometimes it's a family member, like a spouse, or it's their children, or a good colleague at work that, happens to be going to the gym all the time, and then they kind of see those habits and they get invited. It's different for everybody, but trying to understand what is truly motivating a patient. And then also, one of my favorite aspects is diving into what are the barriers that patient is facing. Because if we can try to neutralize, or even at least identify that this is these barriers, or this is a barrier, then that's when we can actually try to help. We can clear the path. The street, a hurricane came through, all these trees are on the street and cars can't get through from point A to point B. But if we can understand, like, okay, we got a tree here, and we just map it out, right? And we can do that as we're talking to these patients and getting to know them and understand them from that perspective. Then we can try to clear the debris so that these patients can actually get from point A to point B, which is what they're truly capable of. And I would actually take it one step further and just say that, as you clear the debris, that encouragement along the way, kind of like, that helpful friend, like your car just breaks down and that person gets out of their car and, decides to help you push that car in neutral. Like, you didn't ask for that. You were over there trying to push that car in neutral, huffing and puffing. You weren't expecting a handout because you live in America and it's such an individualized country. So you're just trying to push that car. But then people start getting behind you and pushing that car. And that's what we as doctors can really do. So I think that concept of motivational interviewing and support really goes a long way.
I love the metaphor of kind of clearing the streets. It's it's clear we both lived in the Caribbean because both of us have probably had to do that after hurricanes while we were in med school, which is a little known maybe character building exercise for those of us that are Caribbean graduates.
Yes.
Studying by headlamp and then having to clear the streets afterwards. But using that same metaphor, I feel like patients have more things than ever dirtying up their streets, right? There's misinformation from media, there's misinformation from food companies, there's conflicting health advice. Tragically, we can't even all agree on whether vaccines are objectively good or bad anymore, right? Like, we're calling into question things that were previously inviolate from like a public health standpoint, right? So how do you help them navigate again, use your same metaphor, like as debris keeps being shoveled into their way, how do you help make sure that like they know you're the source of truth, that they can come to you, that they're reaching out to at least understand what truth is instead of just taking it on first assumption?
Well, that's a challenging aspect, right? I feel like it's so multifactorial. When it comes to truth, one of the challenges that we're really facing is actually trying to get more doctors to do exactly what you and I are doing here right now, and that is be more available digitally, to be leaders in our spaces, and then to be able to provide that information in a way that's tangible for patients. So we have to really try to counteract some of the weed and debris that's really on people's feeds, really and truthfully. I mean, there are so many different aspects. People just don't know where to go and what to do. They see something on Facebook, TikTok, Instagram, and then that becomes truth. People are rubbing banana peels on their faces, coming into the clinic with, contact dermatitis, and we're just like, what made you do that?
Why were you doing that? I don't.
So, I feel like we have to, I think it's as technology and as society is really changing, I think that our roles and responsibilities as physicians are changing. I think that we have to meet the patients where they are. If they are on these platforms and we have the background knowledge, expertise to be able to direct and steer people in the right direction, then I think part of the responsibility from a public health perspective, like I love that you're a public health nerd, by the way. From a public health perspective, we have to doing the assessment, seeing where they are. If they're there, then I think part of our role and our moral ethical code is really to try to put ourselves out there a little bit and try to help these patients, meet them there, show that you're that leader, show them that, give them that information, provide that information, or at least direct people in that information. I would say that that's probably the answer to part of that question. The other part is really looking at, I would say awareness. I would say that it's really, when we're in that patient encounter, it's a lot of these patients and a lot of people around the world, they don't know what they don't know, right? And so when they at least are in the clinical setting, then we can at least try to dial in, ask those open-ended questions, get to know the patient a little bit better from a personalized standpoint, and then try to see how well they are receptive to some information that they may not have been aware of. And then being able or willing to have that difficult conversation, maybe even posing it as a question. Hey, I think I might have a little bit of an idea as to what's going on here, but, tell me, would you like, how would you like to hear this? Or, do you feel comfortable if I share that with you, to kind of break down those barriers and have those tough conversations?
I love that approach of like, I mean, frankly, it's hard, right? Like, let's just address that it's hard, right? It's going to take work counterbalancing, loud voices of misinformation, and frankly, like well-funded voices of misinformation. It takes work, but that doesn't mean that it doesn't have benefit, right? And at the end of the day, as long as you can trace that to your patient, to the clinic, to the care that you're able to provide, like, there's absolutely value in that. I'm not gonna lie, I get tired, right? Like, I think we all get tired. It just feels like you're Sisyphusian, you're just rolling a rock uphill against like a torrent of misinformation. But I love that in your concierge practice, like, you're seeing the value of being that trusted partner. Which I think brings me to my next question. Like, how do you measure success in a concierge medical practice? There's standard clinical outcomes. You come from managed care world, right? Where it's X amount of diabetes per population or X number of heart, you came from, I think, probably one of the most population-based health metrics to now you've got this much smaller patient panel. Like, what does success look like in concierge medicine and when you've won, so to speak?
I would honestly say it's different for, of course, it's different for each patient, but there's a lot of actual tools available to doctors that can allow for, assessments. The CDC actually has a lot of tools available that actually allow you to identify barriers to exercise, or things like SF36 scores, right? Or you can use MD-Calc. And this SF36 basically is a quality of life metric. To basically, you can assess what their quality of life is now, go through your encounters, and then reassess that score in about 3 months or 6 months or 12 months and see if their quality of life has improved. So there are some scoring systems available. You can use those. Some universities publish those, and I like to use those. I would also say that there are, and this is where it gets a little bit challenging. And I would say that there are some devices and equipment that do allow for that more dialed in assessment. So, for example, in our clinic, we do have a bioimpedance machine. And for those who don't know, a bioimpedance machine is basically, it uses small currents of electricity to identify the amount of body fat and skeletal muscle and water and where those distributions are in the body. So when I have patients on my weight loss programs, I can see, okay, you have this level of visceral fat, you have lower skeletal muscle in your legs, but more in your upper body. So, you're a little bit unbalanced in that regard. And if we're losing weight, it's like, okay, yeah, you're losing weight, but unfortunately, we actually lost about a pound of muscle and the body fat actually went up. Right. So, those little tools can actually be really helpful to, personalizing medicine as well.
I love that. And bring that objective data then to the bedside, right? Because I think sometimes, quality is so hard to measure, right? But at least having a yardstick is important. That kind of like healthy body composition has been very challenging historically. We know BMI didn't do it, right? We know BMI is wildly inadequate to really tell the true story of whether somebody's healthy. So I love bringing new technology to it. So, yeah, I want to hear more about, kind of the future now of concierge medicine and where you see it going. So how do you see personalized concierge style care, reshaping the broader healthcare landscape? Like, what's it going to do to, kind of big health?
I think that we're seeing an age in which we're moving towards prevention.
Finally, after 2,000 years of medicine, we're finally back in prevention.
You're doing it. Treatment took us far enough, right?
yeah, exactly. Yeah.
We've seen the capitalization of treatment systems that have led to mistrust of the field we love and care and treat within. But I would say that we're moving towards prevention. I think that's where a lot of this concierge is really kind of taking off. People are seeing that they're having, these difficult times. They're seeing their family members go through conditions that they hope they don't want, that they are fearful of and don't want to go through. They're seeing the check engine light on when their lipid panel comes back or that A1C comes back a little bit high, and their bodies are telling, or a little bit of some osteoporosis, or not osteoporosis, a little bit of osteoarthritis in their knees, or, because, that injury a long time ago, but this weight sure doesn't help, right? And so, people are kind of waking up a little bit to saying, I can see that this is an issue, and I can see if I don't do anything about it now, it's going to be even more of an issue down the road.
just described me to a T. I got my lipids. I got a lipid panel back yesterday and found out I have osteoarthritis in my foot from an old injury. So you were those hit pretty close to home there, Dr. Cox.
Come to California, Dr. Palmer. Let's do this thing.
I was going to say, I mean, talk about individualized. Jeez, I mean, it's speaking right to me. So
you don't have to go to statin yet. They raised it to 10% instead of 7.5.
yeah, exactly. Yeah. So where do you see then, on top of concierge style medicine with this like really individualized treatment plans, the focus on prevention, now bring that to cardiometabolic and longevity medicine, right? Because I think we talked about blue zones. We talked about, you were very coherent. I completely agree with you. Like people want long, rich lives. That's just full stop. People want long, rich lives with quality in them. And that's where longevity medicine is going. So where do you see the next 5 to 10 years of individualized cardiometabolic care and then longevity medicine all merging together now in kind of this, what I hope is really brilliant space?
I really love that you're actually calling it, longevity medicine. I think that, that is an underutilized term. I think that it's really a ballooning specialty that really is, hasn't made its way into the ABMS yet. So, this is something that it's going against the grain, right? It's going against what our forefathers kind of had envisioned when it was like treatment. So, I think that's a great first step, is identifying that this field of medicine does exist. That should exist, and it's actually really catching on, and patients are looking for that type of individualism. As to where it's going, I really do kind of envision this world, right, where we have the use of technology and digital systems to be really able to identify, and particularly as we speak to cardiometabolic health and longevity, these biomarkers, and I think that also we'll be able to better understand how environmental factors, particularly things like diet, might be contributing to different changes that happen within the body. I don't think it's going to be very long before we're able to assess someone's urine or excrement, to be able to say, when you have a hamburger, this is causing, inflammation in your body, and certain levels are rising. And when you have, some like a quinoa salad or whatever, I'm going to extremes here, but there are some definitely food groups in between, right? That actually lead to, that antioxidant production is actually leading to significant protection. And I think that we're going to get to a point where we're also getting further into precision medicine, genomics, taking in genetic information and being able to say, based off of your family history, you're more prone to prostate cancer, and therefore a diet with minimal dairy would be advisable for you going forward. So replacing that milk with maybe some soy milk, despite the incorrect assumption that might actually lead to prostate cancer because of the isoflavonoids that actually might trigger some estrogen response that's actually protective. But that's another side point, Dr. Palmer. What I'm trying to say is that I think that we're going to get to a point where we'll be really able to get way more information out of people just living their normal lives, and be able to adjust their environments to be able to support them as they go through that quality of life, reaching that centurion level, and probably even beyond that.
That's amazing. I mean, I think it's an incredibly valuable goal to set, right? And it's a big goal, and it should be, but I love that now more than ever where I see it's worth this nexus of technology and information systems and wearables and data analytics and in time, like it's really all coming together in kind of this beautiful way that, assembled correctly and coached correctly, we can really start to see this tailwind in longevity and longevity medicine. Okay, I've got a series of true/false questions for you. Okay, which we're gonna run down. We're into the rapid fire zone now, Dr. Cox.
Okay, all right.
True or false? Personalized care beats traditional clinic visits for long-term patient adherence.
True.
Why? I mean, this one seems obvious after the last hour of talking together.
I thought this was just true and false. When it comes to adherence, people need to, it needs to be tailored in a way that fits into people's lifestyles. It has to be tailored in a way that's going to fit into, if you in a very maintained encounter, it's very difficult to kind of get into the weeds as to, well, yeah, I know you should diet and exercise. Obviously, your lipid panel came back; it's elevated. Your A1C is in the prediabetes range. All this basically is screaming metabolic syndrome. You need to diet, exercise, lose some weight, see me in 3 months, right? I mean, that's what's kind of sometimes what you have time for. But when you have this kind of precision-based longevity medicine clinic, then you're able to kind of say, okay, how do I break this down to this patient who happens to be a mechanic coming into me eating McDonald's on the way to work, and then Chick-fil-A on the way back home after a long day of manual labor? Well, sir, I'm looking at your labs right now, and your check engine light is on. Right, I don't want to see, and I don't think you want to see a side in which this A1C goes past that 6.5, and now we have to do all the screenings, we got to put you on medications, all the stuff, right? And I think that maybe on that route home, what do you think that we can maybe pick up on instead of McDonald's? Why are you stopping by Chick-fil-A at the end of the day, right? Having that time in that situation, in that environment, and knowing the patient well enough to be able to present things in that manner, that leads to adherence because they feel heard and understood, and it fits what their health belief.
I love it. It's individualized right there. It's you're speaking to them as an individual, and people are always going to it's going to resonate more with them that way. All right. Next up, lifestyle interventions are more powerful than most medications for cardiometabolic health.
You don't allow me to go in between and say both? Okay.
No, we got to pick one. This one's binary.
This one's binary. The answer is true. The challenge is, if we can speak on it a little bit,
Yeah, please.
I would say that the lifestyle, they both have challenges with regards to long-term compliance. Right? I mean, people don't want to be on medications forever. It's probably one of the most common things that gets said in the clinic. Doc, I don't want to be on this forever. I don't want to be on this for the rest of my life. And to be quite frank and honest, aside from water and food, there's very little things that we do every day of the week for the rest of our lives, of course, from biological processes that, waste elimination, things like that. But outside of the basics, I would have a hard time taking a multivitamin every day for the rest of my life, to be quite frank, right? Same thing when it comes to lifestyle medicine medications. It's going to be difficult to basically do a specific diet or a specific exercise training every day for the rest of my life. Some days, even throughout history, I still want to have, that cheat meal here and there. I'm not going to eat clean for the rest of my life. Yeah, okay, I might want to indulge a little bit. I might want to have some Haagen-Dazs or some Alden's ice cream. I might have a little bit of Baskin-Robbins here and there. And the thing is that that's okay. Like, you can. It's just as long as you're not doing it every day for the rest of your life. So I would say lifestyle definitely beats the medications long term. But I think that it has to be a delicate balance there too.
I appreciate that, and we'll re-acknowledge here for everybody that you did try to answer both.
I did.
You tried to answer that both are critical and important, and I forced you into it.
You caught me that way.
Yeah, it's important to revisit that. So, all right. Next up, true or false? Technology will revolutionize patient monitoring more than new drugs in the next decade.
True, but darn, you're getting good at these questions, man. True. I mean, you made a mention earlier on about wearable technology, right? And I think it's going to get even probably further than that. But the ability to be able to capture that amount of data to better understand your lifestyle, to be able to propose more tailored versions of treatment and modifications that will ultimately lead to your longevity. That's what people are looking for. That's that technological aspect that people are willing to include into their lives, as long as it's safeguarded. And we'll obviously on another podcast or another show of yours have to discuss that ethical question, but we'll get to that eventually.
We're going going to have a whole separate interview just talking about the ethics of these decisions. But yes, and where we go with the data and who owns it, and
Should we make this a weekly thing? Or?
yeah, and whether our X-rays now are racist because they're seeing racial information, and that's
Yeah.
problems
Yeah.
we're gonna have to dig into at this next evolution of medicine.
Yeah, we're gonna definitely need more, a diverse group of trainers for the artificial intelligence to overcome those biases. But
All right, next up, everybody should be taking metformin as a form of longevity medicine.
false. I don't think that there's anything that should be taken every day. I mean, aside from, some good amount of antioxidants from some fruit and vegetables and some water and, basic life needs. But no, I don't think that there's a prescribed medication, and I don't even know if that's truly synthetic or natural, but regardless, that should be taken every day to meet longevity needs. I think when it comes to longevity, you're looking at it in the mirror, and that's actually why we named our clinic Mirror Health and Wellness. It really starts from within. You're seeing yourself. You're the beginning of the process and the journey. And so I think that it's all within you. You can look outside of into the universe and see all the stars and constellation, and all that's really within you. And then the same thing goes in this format. So your body is capable of amazing things. It can heal itself. It can regenerate different cells. And if you give it the right environment, it will do its job outside of known pathologies, of course. So no, I don't believe that metformin is necessary for all individuals to meet their longevity needs.
All right, good. And then lastly, processed food is more dangerous to health than most people realize.
I am so glad you asked that question. True. I mean, I was going to send you that. I don't know if you got a chance, but you're pretty inept when it comes. I mean, I'm not inept. You're pretty in depth.
It depends on who you ask. I mean, and it's probably yeah.
You're pretty in depth when it comes to the public health issues that are being faced, and a lot of the literature that's kind of coming out too. But the Lancet just dropped a bombshell report this week regarding, it was like a 3-series publication, one of the oldest medical journals that we have to read from like the 1800s. And basically it was just going on about ultra processed foods, and it made its way into several international news networks, but basically talking about how global corporations are really using sophisticated tactics to basically protect and maximize profits. And really, it's so sophisticated that it's at a point in which education, or educating our patients, and behavioral change by that relying on behavioral change is basically insufficient. Declaring it one of the most recent urgent public health threats facing us today. And so I think ultra processed foods, they were calling for a regulation of ultra processed foods, but I think more importantly is probably going to be the improving of access to fresh foods and minimally processed foods. And then really just providing that, you don't know what you don't know, like we talked about. So providing that awareness is going to be very key. But yeah, ultra processed foods are really taking us out down that cardiometabolic pathway.
I love that our timing on this is pretty much perfect, because that dropped. I mean, it's a 200-year-old medical journal, and they just dropped that, I think, like this week, within the last couple days. And you're absolutely right. I mean, the Lancet has always been one to, stand up. It's got the history. And so we'll stand toe to toe with trillion-dollar industries. And so I would encourage everybody to take a look at the 3-part series. It's really a brilliant piece of medical investigative journalism almost. Like, there's certainly like an investigative component to it about how did this all happen and the history behind it. I think it's something we're going to be unpacking in terms of what do we do now for a long time. Something tells me in this country, probably not nearly as much as the English might be doing, where they have a little bit better control over some of their industries. But, and I'm saying that because the Lancet is an English journal, and I think the study team was largely English. So, but fascinating stuff. So as we wrap up here, Dr. Cox, we've got one question that we ask everybody here. Everybody gets to answer this question. And that's, what's something that you've recently changed your mind about?
You're going to love this, Dr. Palmer. I want to say, It's tough, and it's not going to fit everyone. But you're asking me personally, so I'm going to share my experience.
Please.
It's not all about the money. It's not all about the money, Dr. Palmer. You know, I feel like one of the things that's so difficult in medicine is that we are, as a result of, I can't remember what act it was. I think it was the Balanced Budget Act, 1997, basically just stripped training programs of cash for being able to train physicians long term. And what that, it not only just basically prevented physicians from being able to enter in residency programs to be able to provide care to people who need to face a physician shortage in America. No. Not only that, it would also just basically have most residents working 80 hours a week, taking care of patients day and night, making $50,000, maybe a little bit less, maybe a little bit more. But that was, working those kinds of hours is so difficult to be able to provide for yourself. So you're basically having, physicians face being economically challenged in taking care of themselves. And now, don't get me wrong, there are other groups that make less that can still do, still have to make things work. But you're talking about working those 80 hours a week, taking care of patients in the ICU, taking care of patients in the ED, taking care of patients, wherever they are in the healthcare system, and doing it in a way, and then coming back home exhausted, and then feeling those financial pressures, knowing that their attending is making $200, $300, $400, $500,000, and they get to go home at night while they're, covering those patients inside of the hospital. And so it's no surprise that once physicians get out of training and they're finally making larger amounts of money, that they're going to seek employment or in entrepreneurship, and look for the highest bidder, right? I mean, there's no surprise. There's student loan debt, which is another topic that we haven't gotten to, but hopefully we'll get to on another show of yours. But there's all these financial pressures. So obviously the best way to get out of those financial pressures is income. And that does lead to a lot of challenging situations. But what I have recently changed my mind about, Dr. Palmer, is really, it's not all about the money. It's what that passion is deep inside you, and then being able to creatively, constructively share that passion with the world and basically enjoy what you're doing for the rest of your life. If you can do that, then hopefully, and there are ways strategically to still get paid for doing that, what you love. And I think that really, it's not about the money. That's what I changed my mind about as I've transitioned into this new level of being able to deliver care in the most passionate way that I can possibly do so, and be able to kind of share my childhood obesity story to help those who are facing obesity on their own, and see them come in completely defeated, and then leave elated, encouraged, and motivated. That to me is worth more than money.
I love it so much. Thank you for ending with that one. That's the first time that we've heard that thus far, Dr. Cox. So I love that, even though we asked everybody this question. But to wrap us up, so where can our listeners follow you and learn more about Mirror Health and Wellness?
We just recently received a grant from the American College of Physicians. We're going to be rolling out some more videos, trying to tackle some of the misinformation online. So find us on Instagram. That's probably the best place for us to start. We'll be branching out to things like YouTube and TikTok, and breaking out into different social media platforms to meet patients where they're at. And we had that conversation, and that's where we're going to go. We're going to try to get into the trenches of this misinformation, find people who are having these challenging moments in their lives and looking for some support, and try to provide as much detailed, evidence-based information so people can actually hang their hat on something at the end of the day. You can visit our website at mirrorhealthandwellness.com, and of course, hopefully you and I, Dr. Palmer, will be having more of these talks and conversations, so people can always get some more public health information that way as well.
I love it. And then lastly, how can physicians or patients connect with your concierge practice outside of Mirror Health and Wellness?
So the website will probably be the easiest and best way. We have a phone number there. You can easily call that and get in contact with us. Outside of that, I guess personally, I guess that would be really challenging unless they want to go through you, Dr. Palmer. But
they can always reach out. We have an email address for this podcast. They can absolutely reach out, and we'll connect you with Dr. Cox. He's obviously a personal friend of the podcast, and we're looking forward to continuing to have him as a guest.
I appreciate that. We'll work together on this one, and then I'll be sending people your way as well, Dr. Palmer. I appreciate you and this podcast so much, and I really just appreciate your mindset. Honestly, it's hard finding similar mindsets, individuals, but like we said in the very beginning, being able to connect on these similarities, on these issues, is one of the best things about medicine and being able to deliver care. So thank you for being able to put this all together. Again, Dr. Palmer, it's been a pleasure.
Thank you so much, Dr. Cox. I really appreciate your kind words there, and we're looking forward to having you back.
Thanks for joining us this episode. You can catch the podcast For Doctors by Doctors on Apple, Spotify, YouTube, and all the major podcasting platforms. If you enjoyed this episode or learned anything here today, please take a moment to give us a rating and subscribe so that you don't miss a single episode release. As always, thank you for listening. And the next time you see a doctor, maybe you should prescribe this podcast. We'll see you next time.